Hi, today we're going to talk about psoriasis because it's more than just a skin condition. I chose to talk about psoriasis because many people think it's just a cosmetic issue, but it's actually an autoimmune disease that can impact mental health, relationships, and overall quality of life. But what is psoriasis? Psoriasis occurs when the immune system mistakenly attacks healthy skin cells, causing rapid cell turnover. This leads to thick, scaly patches on the skin. Triggers can include stress, infections, cold weather, and certain medication. Who usually gets psoriasis? So anyone can develop psoriasis, but it's more common in, first, people with a family history of the disease. Secondly, adults, but it can start in childhood. And thirdly, those with autoimmune conditions. Now, how does psoriasis affect life? Beyond physical discomfort, people with psoriasis may experience social stigma, so the visible skin patches can lead to embarrassment and even isolation. Also, mental health struggles are very important when it comes to psoriasis because anxiety, depression, and low self-esteem are common for people who are affected by this disease. And of course, in work and relationships, psoriasis can affect that because the flares can be painful and make daily tasks very difficult for the people who are affected by the disease. So there are different symptoms of psoriasis. Here are the clinical signs. So your skin can be red, inflamed, and some patches of skin are covered in silvery scale. Also, you can be affected by itching, burning, or even pain that affects certain areas of your skin on your body. Also, the common locations of these patches are the elbows, the knees, the scalp, and even the lower back. Now, how is psoriasis diagnosed? So most of the time it's done by a clinical examination, so a dermatologist can diagnose psoriasis just by looking at the skin. But in other cases that are very rare, a small skin sample is examined under a microscope to confirm the diagnosis, and that is called a skin biopsy. Now we're going to look at the treatment options. So it's important to know that psoriasis does not have a cure, but it exists treatments that can help to manage the symptoms. So first you have topical treatments. So those are corticosteroids or vitamin D creams that can help to soothe the inflammation. Patients can also use a biologic injection, which target the immune system to reduce the inflammation of the scales. You can also use oral medication that can help to slow the skin cell turnover, which slows down the operation of the scales. And some people also use light therapy, phototherapy, which uses UV lights to reduce the symptoms. Now, if we're talking about the long term, with proper treatment, many people manage psoriasis very well. However, without a treatment, it can lead to severe flares, but also joint pain, like psoriatic arthritis. And that disease also can increase the risk of other health conditions like heart disease. If you're wondering if psoriasis can be prevented, the answer is yes, although it's not 100% preventable. Many triggers can be managed, which can help. So to prevent psoriasis in the best way, you can try to reduce your stress through medication and exercise. You can also avoid smoking and you limit your consumption of alcohol. You can try to maintain a healthy weight and diet. And of course, which might be the easiest thing, you need to keep your skin moisturized to prevent irritation. Now, I'd like to say that it's important to spread awareness and support to those living with psoriasis. So if you or someone that you know struggles with this condition, know that you're not alone. Now, if you want to do something important, you can share this post to help educate others. Thank you for your attention.